then I always make sure to use the
Slides.
What's that? No, I can do it. That's totally cool. So I always make sure that everything's kosher before I come in and present. So I hate to do this to you guys because you're eating, but this is not going to take too long. If I could have everybody stand up for a minute. My apologies because that rack looks insanely good and that Thai food over there looks amazing. Okay, so we're going to do an exercise here to integrate these concepts, and some of you have already done this if you've attended some of my presentations. But this is a simple way to acquaint you with what we do. So what I'm going to have you do is I'm going to have you elicit a response, elicit a relaxation response. And it's going to be very simple. We're just going to take our non-dominant hand and we're going to place it right on the belly button, like so. And what we're going to do is known as a reverse diaphragmatic breath. So we're going to breathe a little bit differently. We're going to pull the stomach in towards the spine. And then as we exhale, we're going to soften and round the stomach, and at the same time, kind of sink into the feet. And that gives you a real nice grounded quality. It's a really nice exercise. We're going to do 3 of those together. And I just want you to pay attention to how you feel now, and then pay attention to how you feel after 3 breaths. So we're going to do 3 together as a team. So inhaling deeply, hold, and then exhale, softening and sinking. Inhale deeply, hold, exhale. One more time, inhaling deeply, hold, and then exhale, softening and sinking. Good. How many of you feel more relaxed, more energized, more focused, more present? More importantly, more embodied? Yeah? Okay, good, good. That's where we want to be. Okay, so we're going to do something else here. So again, non-dominant hand to the belly button. And then take dominant hand, and you're going to cover your eyes like so. And I promise, I swear to God, I'm not going to make funny faces at you. So I want you to imagine that this hand in front of your face is your stress response. And I'm not just talking about your normal stress response. I'm talking about a stress response that with something that happens on the ward, something that happens within your family, a pretty significant stressor. Now again, I want you to connect with that diaphragmatic breath. So inhaling deeply again, and then exhale, soft, round sink. Inhale again, and then exhale, soft, round sink. One more time, inhaling deeply, and then exhale, soft, round sink, and lower your hand. Take a look at the slide. When we consciously elicit the relaxation response in the face of a stressor, we see things with greater clarity. And this is vital in the profession that you guys are in, given the demands that you face. Not only do you have the medical demands, but you have the military demands, so a double whammy. So go ahead and have a seat. Thank you for being good sports. So a true path to seeing things with greater clarity is through mind-body medicine. So mind-body medicine, quite simply, is a new and emerging discipline that focuses on the inseparable connection between our minds and our body. So theoretically, working with our minds can impact our physiology, as well as working with our physiology can calm and center our minds. So just out of curiosity, how many of you have, and this is a very physically oriented culture, how many of you have had an absolutely crappy ass day and gone to the gym and felt immediately better afterwards? Okay, I expected to see a lot of hands. In a way, you're practicing mind-body medicine. You're working with your physiology to bring yourself back to center. And this is an important concept to remember. So mind-body medicine proposes that our unmanaged and overwhelming stress leads to illness and dysfunction, and illness and dysfunction leads to more stress, and so on and so forth. Thus, we get on this merry-go-round ride that really gets us absolutely nowhere. And it also makes zebras lose their stripes, unfortunately. A little Sapolsky humor for you there. So it further proposes that there are a number of healthy self-care modalities that you, the individual, can integrate to manage your stress and to increase resilience. So just out of curiosity, you guys are very learned individuals. What is your definition of resiliency? I'd be interested to hear that. Anybody? Yeah, shoot.
Your ability to withstand stress.
Mm-hmm. Yeah. Anybody want to add to that?
After experiencing stress, coming back to your baseline.
Yeah, absolutely. And I want to share with you what I share with patients, because there's a lot of definitions for resiliency. Academics, as you know, love to argue about things, okay? So there really is no agreed upon definition for resiliency. If you look at the definitions, you'll see an APA definition, you'll see Marston, you'll see Yehuda. I recommend that you look at the literature. There's actually a book by Stephen Southwick on resiliency that you can get on Google Scholar, and it's free. It's a great book, and it's about all the ins and outs of resiliency. But I digress here. So to give you a bachelor's in resiliency, and I always tell patients, number one, it's to bounce back from adversity, and very often use the trampoline analogy. And then the adapt, or the BA, is to adapt from said stressor that you're bouncing back from. So you can grow and evolve from that experience. And now we take it to the master's level to bring into your awareness that resiliency itself is not static. And that's the reason why I have this rubber band here. It is a very dynamic process. So if you wouldn't mind taking a look at this rubber band, okay? So our ideal place with resiliency is here, nice and snug, Goldilocks zone, okay? So that if there's any sort of issue, I'm moving my hands, I'm trying to deviate my resiliency zone, what happens? I go back to the resiliency zone, okay? Now, if I'm the typical individual out there in our world that's taxed and overtaxed and dealing with an illness, I could be here. What's going to happen if I keep going? It's going to break, yeah. It's going to go beyond where we want it to be. Similarly, and you've seen this with some patients, when it's flaccid like this, we have the depressed individual, we have the dissociative individual. There's no engagement. So we really want to build resiliency, and we want to get into that Goldilocks zone, okay? Now there are a number of ways to build resiliency, okay? This is my very, very bad attempt at humor, okay? Some of you may have seen this already. But humor itself is a really great way to connect with resiliency. And I highly recommend that you seek out the persons in your workspace that can help you to connect with humor. It's a really good resource to have. I learned that early on in working in behavioral health. You know, I had a really cool supervisor. He was a social worker who was a military guy, and he was as stern as could be and as cranky as could be. He had shrapnel in his spine, okay? And the one thing I liked about him, though, was he had a great sense of humor. And anytime the therapists or the case managers were feeling the effects, a psychiatrist, he had this boom box with fart noises, and he would just randomly put it by someone's office. They wouldn't be seeing patients, of course, at this time. But it always deviated the tension. It took things to a better place, okay? So that's a hack towards resiliency, and that's something I always encourage patients and providers to look at. Another thing is inspiration. If you're not on the email stream from Chaplain Leverett, get on it. He sends inspirational stories just about every other day. He's a really great human being. So if you can connect with inspiration, it shifts your perspective. And here's a really great quote from Bruce Lee. In addition to being able to skillfully beat people down, Bruce Lee was also, believe it or not, a poet as well as a philosopher, a really deep thinker. And he states, if you always put a limit on everything you do, physical or anything else, it will spread into your work and into your life. There are no limits. There are only plateaus, and you must not stay there. You must go beyond. And in doing this training and maybe potentially going to some of our offerings, we do have a staff class that's starting, by the way, in October. You are taking that step going beyond your plateaus. You're integrating another tool to help you to build resiliency, to be great providers, and to be great human beings. And mind-body medicine can do that for you. It can help you to take control of your health and wellness, and it can help you to effectively manage and cope the rigors of being a medical provider and a military medical provider. So a big way of how you get there is through the elicitation of the relaxation response, and we do that through a number of different techniques. You had some exposure, trial by fire at the beginning there. But would someone care to take a stab at the relaxation response? It's kind of a no-brainer, but I just would be interested to hear what you have to say.
So the way that I've always been taught it is it's like you're engaging the cortical, like your prefrontal cortex to help suppress the fear amygdala like response. So that you can use higher function thinking and processing instead of your basic like fear fight or flight response.
Absolutely, dead on. Thank you. That is a perfect definition and gets into a lot of the concepts that I'm going to talk about. They're very basic concepts, but they're very helpful to have an awareness of. And of course, you guys have more of an advanced knowledge in this regard of physiology. But when we share this with patients and other providers, when we train them, it's like it lifts something off of their shoulders. It's identifying the monster that's in the room that they can't clearly identify, and being the stress response. And the relaxation response, contrary to the stress response, is a learned pattern that we can integrate. It's more established in certain individuals. They have more of a tendency there. There's more psychosocial factors that tie into that. But the bottom line is that the relaxation response allows you to engage the prefrontal cortex, which is the regulator, and allows for top-down processing to get you into the parasympathetic nervous system, where you're more relaxed, focused, and engaged, versus the stress response, where we're actively engaging nervous Nelly, the amygdala, and we're in fight or flight, okay? And that's not to demonize all of that. And I'm sure that you're all aware of the work of Kelly McGonigal, of the idea of stress being our friend. If we have a perspective of stress as not this demon, but of something that we can work with to our advantage, it's advantageous. So to get to the relaxation response, we integrate a number of meditative modalities, visualizations, and physical practices such as yoga and qigong into our coursework. Now, you'll see here in our flyers and our offerings, there's a yoga class over at MWR. I highly recommend you check that out after you're done with your shift, if possible. And then again, of course, the staff class. So in addition to eliciting the relaxation response, which is the core component of our program, we also encourage a number of healthy lifestyle factors. So the biggest one is recuperative sleep strategies. How many people here get great sleep? Okay. I'm so glad to see that, because 9.9 times out of 10, a single hand doesn't go up. And it's unfortunate, because sleep is really precious and really important to us. So we teach a number of recuperative sleep strategies. Whether you're getting 2 hours or whether you're getting 6, we help you to optimize. So we teach you a number of healthy sleep rituals and healthy sleep habits. And for those of you that have heard of the work of Dr. Carter is our resident sleep expert. He does have a sleep seminar. So as a provider, if you ever want to sit in on that, it would be a really great way for you to expand your awareness on healthy sleep strategies. He is just a genuinely great guy as well. We also teach fostering healthy social connections, improving communication through active listening, building compassion and empathy for others. How could such hippie concepts find their way into the military? Any idea why that might be useful? So I'll tell you this. We've had a number of Navy SEALs that have come through our trainings, and they have indicated to me, oh yeah, compassion and empathy, we practiced that in our training. And I almost fell on the floor. I was like so surprised. And he's like, no, he's like, you know, it improves our cohesion as a team. It makes us more effective. And, you know, if you look at the literature, if you look at the research on compassion and compassion-style meditations, he's not far off the mark. But it does help you with building altruism. It does help you with building a greater sense of connection with your fellow man. It does help you to elicit physiological improvements in yourself. And we even can have concentrations in gray matter in areas associated with compassion and empathy from doing meditative styles that are associated with building that. And that's certainly very useful. So listening, you know, working in medicine, you know that you have to be able to listen. You know that you have to be able to effectively communicate, especially in an emergency situation. But another thing that we also encourage is to work with our thought process, and this is another critical component. So you can think of your mind as a suggestion box. So for your department, you probably get a lot of suggestions, right? Some of them are great, some of them are useful, some of them make no sense. And a lot of times it's just somebody that's disgruntled, that just wanted to do a tirade and do whatever. And our minds are kind of the same way. Our minds can have really affirming thoughts floating through here, but then other thoughts, when we sit there and we look at it, we're like, my God, where did this come from? So I like to stress to patients, suggestion box. You take the feedback that works, and the stuff that doesn't make sense, you just don't give it the attention. And we teach patients and providers how to do that through our skill sets. And finally, facilitating overall health through self-care. Without self-care, medication and procedures alone is not enough to bridge the gap. Medication and procedures are vital, but if we don't have self-care, then that's problematic. So here's a quote from Herbert Benson. Herbert Benson, for those of you that don't know, is the founder of the Benson Henry Institute, which is kind of the gold star of mind-body medicine. They're over on the Eastern Seaboard, affiliated with Harvard University, Massachusetts General, and they've been kind enough to share their curriculum with us that they use for patient populations and for providers. And we have been in effect since 2013. We are a research program, and they do assist us with our research. Great quote. He states, when people choose a technique that conforms to their own preferences, it is much more likely they will adhere to practice. So thus, we offer a diversity of evidence-based meditations and briefs, and I'll get into what that is in a little bit, into our 7-week curriculum to suit your unique needs, because everybody is unique and different. What works for Dr. Bertone is not going to work for Lieutenant Muller or anyone else, okay? I actually can tell you that that's even not a static construct. If you started something today, what you do 3 years ago could be completely different, okay? The bottom line in this is that it helps to get you in the zone. Out of curiosity, what does it mean to be in the zone, if you had to take a stab at it?
Doesn't have to do with promotion.
Promotion would be nice.
Sorry.
Yeah,
Make
sure.
sure you're working at your best.
Yes.
Optimal performance.
Yeah, peak performance, peak performance. We hear about this from Tony Robbins. He talks about being a peak performer, talks about people being in the zone. If we look at the literature in positive psychology, the idea of flow, okay, this is a very real phenomenon. It's not just isolated to athletes that are making millions upon millions of dollars, okay? It's a state that just about anybody can access if they go about it the right way. And a big part of it is through the practice of meditation. Meditation is really a core component of what we do, and the research and the literature really shows its benefit. It's been researched since the early 70s, when TM, Transcendental Meditation, kind of exploded on the scene. It was a secular form of meditation, a little less secular than mindfulness, which also came on the scene in the mid to late 70s. And then Herbert Benson started studying it, and he coined the term the relaxation response, which you did a wonderful job of getting a definition of. So meditation itself, and this is a definition from Antoine Lutz. He is a neuroscientist over at the University of Wisconsin. If you get a chance to look at his literature, he's really done a lot of research into meditation. He states that meditation is defined as a group of mental trainings consisting of a conscious attempt to focus attention. The object of focus varies according to the specified form of meditation. So a lot of different ways up the mountain. And it's important to recognize also that it goes beyond focus. There are other subcomponents with meditation as well, and this is also from Lutz. He calls meditation a family of complex emotional and attentional regulatory strategies developed for various ends, including the cultivation of well-being and emotional balance. Certainly very valuable commodities for us, right? So with our meditations, typically the eyes are closed, attention is turned inward towards a point of focus. However, we are working with a patient population, a lot of them have PTSD. So we want to try to keep them grounded. We want to keep them engaged in the prefrontal cortex, and sometimes closing their eyes is not the best thing. So I always offer that option and that opportunity to keep the eyes open with a soft gaze towards the floor. And also orienting patients towards laying a light touch on the body and grounding if anything comes up during the meditation. Fortunately enough, we haven't had that happen too much. Commander Milligan, the founder of this program, will tell you that I think the very first class, in that first year, he had someone that had a PTSD reaction, but he was able to effectively mitigate it because of his training. So it does happen, but we want to try to set the stage for it to not happen, for people to be supported, for this to be positive and reinforcing. So might I add that all of our meditations are secular, meaning that the religiosity and the spirituality has been distilled out to a certain degree. We're not going to lie to patients. We're not going to say this miraculously appeared at Massachusetts General. These are things that have existed for God knows how long. Some scholars actually believe that this has existed since Paleolithic times, when we were grouped together around the fire, hoping and chanting for a successful hunt, focusing that attention for success the next day. So today we do have secular forms with thanks to Dr. John Kabat-Zinn, to Herbert Benson and the Benson Henry Institute. They have progressively set the stage for more and more non-religious forms. So with that, I want to add that if you are religious, if you do have a spiritual faith, please integrate it into your practice, because the literature shows that in having that attachment figure and having a higher power brings all sorts of lucrative benefits that you don't have when it's distilled. And it's not to say that when it's distilled it doesn't work. The literature shows that too. But it's nice to have that added edge. So there is a reason why Dr. Evil and Mini-Me are here. So Dr. Evil is representative of our longer style meditations, and Mini-Me is here to represent our briefs. So briefs are literally just that. They are brief respites of just any time during our day where we consciously elicit the relaxation response, we are engaging in what is known as a brief. So literally with the program you have this. You have a 10 to 15 or even 20-minute meditation in the morning or at night, your longer style meditation, and briefs throughout the day to pool together and reap those dividends from the relaxation response, to further anchor it into the system. And the literature shows that that can happen in as little as 7 to 8 weeks with consistency. So a big part of this, and we call these exercises in the zone exercises because they do get you to a peak state. A big part of that is the relaxation response, as we've mentioned. Okay. All right. So we're going to do some briefs here. So you can remain seated or you can stand, whichever is more comfortable for you. So these are all varying practices that come from varying traditions. The first is an alternate nostril breathing. Now, if this is uncomfortable, I just ask that you just breathe through both nostrils together. Okay. So I have the rule of 3, where we do 3 rounds of whatever it is that we're doing, and I encourage patients to do this. So the first is an alternate nostril breath, where we're going to take the thumb and close the right nostril, breathe in through the left, and then exhale, close off the left nostril through the right. Okay? So you may notice with this, with some folks, they find this to be awesome. It's a great way to become more focused, to become more engaged. For others, it's like nails on a chalkboard. So please have an open mind. If you don't want to do it, like I said, breathe through both nostrils. The second one, we're going to do an inhale through the nose, very similar to what we did before, except we're going to do a differing type of breath. We're going to breathe and expand the belly as we inhale, and then as we exhale, we're going to do a long, drawn-out exhale through the mouth. Okay? And with that, I want you to integrate a statement. And your statement is just simply, I am at peace. Very simple. Great way to redirect. One thing you're going to notice about these exercises is that does anybody here work in pediatrics? No? Okay. You know,
Rotate.
oh, okay. So with the puppet, you know, when you're trying to give the shot, there you go, there you go. You know, that's kind of what these exercises are. It's kind of sleight of hand for the amygdala to get you back into the prefrontal cortex, okay? And then finally, we're going to do an exercise from Aikido, and it's called Hara, Heart, and Head. And we're just breathing into 3 different points, and the Hara point would be right here by the belly button. We're going to breathe into the chest, and then we're going to breathe in right up here between the brow, okay? So within Aikido, the idea is martially that you operate from center, and that's pretty much the basis of any martial art. But Aikido also takes into account the heart because its philosophy is to do the least amount of harm as possible. And then, of course, is your head, which is your anchoring point, and that you're moving on a line from these 3 points, almost like you're on a string, okay? It's very interesting art with interesting movement patterns. Okay, so let's start out with alternate nostril breathing. So take your hand and hang loose, okay? Plug the right, inhale through the left, and then exhale through the right. Inhale through left, exhale through right. Inhale through left, exhale through right. Good. Lower your hand. Notice how you feel. Okay, now we're going to shift to the second one. We're going to inhale through the nose and exhale through the mouth like we're blowing out birthday candles. And remember, with the inhale, I am, and with the exhale, at peace, okay? Non-dominant hand on the navel. Okay, ready? Inhale through the nose. Exhale through the mouth. Inhale through the nose. Exhale through the mouth. One more time. Inhale through the nose. Exhale through the mouth. Pay attention to how you feel. Okay, now on to the final one. Non-dominant hand again at the navel point. 3 rounds of breath. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Now to the chest. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Last one, up by the head. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Lower your hand. Pay attention. What do you notice? For those of you that were able to do it. I'll do the cheat sheet. Anyone relaxed? Okay. Anybody more focused? Anybody feel more in their body? Yeah, I see some nods. Okay. All of these are important. All dividends are important, and those are just a few that you may experience. And those are the experiences that you have in the here and now. And I might add that one thing to bear in mind with these exercises, that you may feel relaxed right now, you may feel more energized, you may feel more engaged, you may feel more at peace with humanity, but the minute you walk out of there, that could quickly change. And that speaks to the idea of state and trait-based benefits. So state, right now, we feel more relaxed, we feel more present, we feel more engaged maybe, but that's fleeting. Trait, however, is something a little bit different. Trait is when it gets hardwired into the system. When we have neuroplastic change, where we have atrophy around areas of reactivity and buildup of gray matter in the prefrontal cortex and some of the other associated regulatory areas of the brain, so that we can better regulate our emotions, so that we can be more available to those that we serve, even to our families, okay? One of our facilitators, Lisa Hess, and Lisa Hess facilitates the staff class, and I love Lisa, she's very candid sometimes. She expresses to patients and to staff and train the trainer that she used to be the worst road rager in the world, okay? She would sit there and like follow people, tailgate, beep, 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 flipping the bird. I mean, just off the charts, high blood pressure, right? So she did our trainings, she started integrating our concepts, and over the course of time, she started to notice via her partner that she wasn't doing it anymore. And she's like, she woke up one day, she's like, my God, I'm not reacting to this, I'm just laughing at it. So those are the kinds of dividends that you will notice if you consistently practice. And the literature shows that this can happen in as little as 7 to 8 weeks. So we know that it's about getting us in our prefrontal cortex. We know it's about connecting with the parasympathetic nervous system. We kind of already covered this already, and I'm not going to get too much into detail around that. But some of the dividends that you can start to have are here in as little as 7 to 8 weeks. You can enhance your focus. You can enhance your capacity towards equanimity. Please remember that, it's an important word. It's your capacity to be neutral, okay? How might being neutral be useful for us in a personal and professional manner?
I think just even having like a disagreement over like a differential diagnosis of how to diagnose and then treat someone, you can, if you're being neutral, you can weigh different consults and your own opinions with equal consideration. Yeah,
and that serves not only you, it serves your colleagues, and it serves the patient, right? And rather than being reactive, we could really do some great service if we're able to be better neutral, okay? And that's where equanimity comes into play. And then, of course, we have metacognition, which is an awareness of our thinking. How might having an awareness of our thinking serve us? Think about it. Yeah.
I think we fall into traps sometimes of like default patterns of thinking, and which makes you miss information and like not incorporate it because you get so like ingrained into a certain pattern of thinking. So I think being aware of those kinds of patterns allow you to break them and to incorporate new information.
Yeah. Having awareness, I like to think of metacognition as a bird's eye view, that we're not just getting locked into what is happening in our minds right at that moment, that we can take a step back, that we can just be with whatever is there and redirect and move on to the next thing, or something that's more affirming and beneficial for us. And the practice of mindfulness is a really great resource in this regard. Excuse me, and if you have the time, I recommend you check out Dr. Weitz's class on Mondays. She's a great provider. So then, of course, we have a learned parasympathetic response. We grease the wheel, we get things going with our brain so that it can change with consistency and with time, and we move into a more relaxed baseline, which is very useful for us, because most of us in our culture are redlined. And that allostatic load is off the charts, and we want to bring things back a bit so that we can come back to center and move into more health-affirming places. So, again, consistency is key, and consistency is what's going to create that neuroplastic change. So why mind-body medicine? Well, I'll give you a few reasons here. Number one, first and foremost, evidence suggests that it mitigates a whole host of different diseases. It mitigates a whole host of different struggles. And in addition to that, a little bit more closer to home, through our program, we have found that it also impacts our budgetary effects. So it not only helps our patients on a personal level, it helps them on a mental, emotional level, it helps them on a spiritual level. Those with functional impairment are finding that they're much more capable and able to do things that they once weren't able to do. We found through utilization review that mind-body medicine helped patients have reductions of over $1,700 per year, and that's per patient. Also, prescribed opioids went down from 14 to 10. And, you know, this is not totally earth-shattering, but it's still impactful nonetheless. So in addition to that, I might add that these practices also are beneficial to medical providers, and there's literature out there to support just that. So here you see mind-body medicine being very helpful for a variety of conditions. As I indicated, with chronic pain, I co-facilitate pain management with Dr. Carter, and we see a lot of improvements with our patient population, and our research has shown that. So cardiovascular disease, hypertension, insomnia, surgical outcomes, cancer treatment tolerance. I do know that over at oncology, Jennifer Shands, the NP over there, I don't know if she's still there, for a while they had meditation and auricular acupuncture, all of which are obviously very helpful adjunct treatments to cope with the effects of cancer treatment. And then, of course, we have our big two here, depression and anxiety, that these exercises can actually reduce the symptoms of depression and anxiety. And then, of course, we have some limited evidence, but evidence is still growing nonetheless. Here are some of our results. So this was a preliminary review in 2015. And then we did a retrospective review, Commander Milligan and his team over at NC COSC, where we did a retrospective review, which is now going for publication from 2013 to almost the first of 2017. And we found improvements in perceived stress, stress reactivity, functional impairment again, sleep quality, overall quality of life, and reductions in depression and anxiety. So, you know, this is 7 weeks of treatment, and seeing that effects from 7 weeks, it's pretty astounding. So again, here's that health analysis. I have references if you want to take a look at this stuff. So why this model? Well, Lieutenant Muller can tell you that these concepts are easily learnable. You can do a 2-day training with us, which is available to each and every one of you, where you can learn these concepts, and we can help you to hone your craft so that you can integrate this into your practice. You can start to integrate this with your peers. You can integrate it with your staff, and you become a valuable resource for people. So we found it to be useful with diverse patient populations. We have a pain management group, as I indicated. We have a TBI specific group. We also have a new and expecting mothers group. We have a lot of options and a lot of things that are in development and different things that we're looking at. So you in your respective departments, if you take our train the trainer and you want to bring it to a particular patient population, you help us out and we support you in that endeavor. So these practices are user-friendly, meaning that they're secular, that they're, again, the religiosity and spirituality is distilled, so it makes it much more engaging for people. It's not always the easiest sell. you know, some of the stuff that we're doing gets you out of your comfort zone a little bit. And for those of you that gave it a shot earlier, I give you mad props, because it's kind of weird, man. It's like, you know, it's not your everyday norm that you sit there and, you know, like this. I mean, you know, you do this while you're walking to a meeting, like trying to center yourself. They're like, what the heck is he doing? Is he picking his nose or what? So in addition to that, it's sustainable, and it's sustainable through those brief exercises that I shared you. And again, it's so effective for you guys not only to work with your patient population, but to help you to mitigate your stress, okay? So here's some literature. It's not like off the charts power, but some of it deserves some attention, okay? In particularly the study by Mudio and colleagues. It's a nice longitudinal analysis over the course of a year with 42 physicians. It was an RCT that went through mindfulness course. They went through MBSR. And after the end of a year, they found that they reaped dividends and continue to reap dividends. That they had an increase in awareness, greater relaxation, positive emotional states, and heart rate reductions that maintained for a year past the training. Really fascinating stuff. Okay, so Lieutenant Muller requested that you guys have lots of practice, so you are getting lots of practice. We've got about 18 minutes. We're going to use the rest of that time to do some practices. Before I do that, and I do need to jet out of here real early to make our MBM meeting today, does anybody have any questions?
Do you have like referrals, or can we refer patients to you, or how does that work?
So our referral process is right here for you in this pamphlet right there on the front. And if you run into any problems at all, just give me a call.
Thanks.
Yep. It's a real simple process. What we do ask is that you integrate the patient into the equation. Sometimes providers, God bless them, in their desire to do great things for patients, sometimes they don't tell them what they're doing, and they're just kind of like, I think this will work for you. And then, you know, the patient comes to us and they're like, why am I here? And if you can just kind of give them just a basic background, not too much, then just send them our way. I do our introductory class and our intake, so I assess patients. So if you have a patient that you think would be a bad sell for group, let me know right off the bat, because I'll work towards getting that patient some individual mind-body medicine. We've had some folks that are so triggered in their PTSD that we have to work with them individually. We've had some folks that just have anxiety and phobic reactions that it's not productive towards having them in group. So please consider that and feel free to contact me. Okay, anything else? No? Okay. So we're going to do a few exercises here, some really relatively brief exercises. And any of these exercises can be done for longer durations, shorter durations. I have a few here that I generally share with patients in our introduction to mind-body medicine class here, and you feel free to go ahead and take that. So a couple things when you do these exercises. If you do our coursework, if you go through Train the Trainer, we drill this in because this is important. When you do these exercises, you want to have a sustained mental focus. Now, your sustained mental focus can be your breath, it can be your body, it can be the repetition of word or phrase. It can also be visualization. There are other ways to focus your attention. In fact, there's actually a yogic style meditation that I was shown one time where you just sit there and stare at a candle and your eyes start to water and it's like really strange, okay? And that's not for everybody. But for some folks, that might be focusing in on something visually might be what works for them. So that's why we like to offer a lot of different ways up the mountain. So number 2 would be your perception and your attitude. So if you can adopt an attitude, open, receptive, non-judgmental awareness, that really serves you in 2 different ways. So number 1, rather than getting competitive with yourself and agitated when your mind deviates from your point of focus, you keep yourself in a more relaxed, consistently relaxed state by just bringing the mind back and just recognizing that that's what the mind does. And if your mind does that, if you gotta bring it back, 100 times, that's completely normal, okay? The other piece in that is, remember the word equanimity, when we talk about equanimity? If you practice this non-judgmental awareness, you start to hardwire equanimity into your system. That's why practices like Vipassana and mindfulness really work, because people sit with their experience. So, has anybody here ever practiced mindfulness? A few people, I see nodding in their heads. Very often a big integral part of that is the body scan, and to bring awareness throughout the body and just be with whatever is occurring. And that really reaps dividends in this regard. Okay, so any questions? All right, so I have you go ahead and get yourself comfortable. Typically with this, you want to sit with the spine straight. You want to have your feet on the floor. Anytime you're working with a patient and your patient is really getting very anxious, you can redirect them, and you can redirect them towards their body. What I like to do is I like to refer patients to the felt sense of the feet on the floor. Now I've done some, has anybody here heard of TRM? Trauma Resiliency Model? No, okay. So I've done some training in that, and a big part of Trauma Resiliency Model and going out to communities that have been traumatized is to get people back into their bodies, okay? To have that felt sense and to get back into the prefrontal cortex. So you want to have the spine straight, hands can be in the lap, up or down, whatever is more comfortable. And typically the eyes are closed, but if you want, maintain that soft gaze towards the floor. So now I want you to take your non-dominant hand and again place it on the navel. And we're just going to start to breathe into the belly. And I just want you just to feel the movement of the breath as you breathe in and as you breathe out. So we're looking for expansion and contraction. And as you're doing this, you may notice the mind wandering, and just gently bring it back to the point of focus, which is the breath at the belly. And as you deepen this practice, you may start to notice a wave-like quality. Very much like the ocean, coming in to shore and going out from shore. Waves come in and waves go out. You can even utilize that visual and when the mind deviates, we gently bring it back to our point of focus. This is a very simple process, but a very effective process. And now I want you to begin to deepen your breath. And I want you to inhale through the nose and exhale through your mouth. Inhaling through the nose and exhaling through the mouth. Deepen that breath. Really circulate that oxygen. And we're going to do 3 together as a group. Inhaling deeply. Hold. And then exhale through the mouth. Inhale deeply. Hold. And then exhale through the mouth. One more time. Inhaling deeply. Deeper still. Hold. And then exhale through the mouth. Make some small, subtle movements with the hands, fingers, the toes, and the rest of the body. And when you're ready, you can open your eyes, relaxed, focused, and engaged. Good. How was that one? A little bit better. I see a little bit more receptivity, a little less hippiness about that one. Yeah, it's a very simple process, and it's something that you can teach patients. It's not very complex, and it's a tool and a resource that you can give them when you have that anxious patient that comes in. Okay, you can bridge the gap in their care in referring them to us for further education in our implements. Anybody want to share anything about that? No? Okay. More time to do a few more here. So again, I'll have you go ahead and get comfortable. And now we're going to do an exercise that's based off of Vipassana meditation, which is kind of the granddaddy of mindfulness. So I have you go ahead and close your eyes if you've not already done so, or that soft gaze towards the floor. And what I'm going to have you do is I'm just going to have you bring attention and awareness to the nostrils. And I just want you to observe and be aware of the inhale and the exhale through the nostrils. And we're not trying to change that. We are just merely observing it. Very much like a biologist would observe its subject in the wild. And you may notice coolness, you may notice heat, you may notice discomfort. This is an open-ended inquiry, and there is no right or wrong answer. Just merely observing. Now we're going to expand awareness to include the nose itself, and just observing the sensations of the nose and even up into the cheek, going all the way up to the bridge of the nose at the eyebrows, and just observing any sensory information that you find. And just observing whatever you're sensing or perceiving. Remember that there is no right or wrong answer. And now I want you to begin to deepen your breath, inhaling through the nose and exhaling through the mouth. Inhaling through the nose and exhaling through the mouth. And we're going to do 3 together. So inhaling deeply, hold, and then exhale through the mouth. Inhaling deeply, deeper still, hold, and then exhale through the mouth. One more time, inhaling deeply, deeper still, hold, and then exhale through the mouth. Begin to make some small subtle movements with the body, fingers, toes. And when you're ready, you can open your eyes, relaxed, focused, and engaged. Good. Anybody want to share on that one? Is that one a little bit more difficult, a little harder? I sometimes get mixed feedback. Sometimes one is amazing and then the other is god awful. That happened a few times. So simple resources. Your body and your breath are great resources, and they're very simple resources that you can access at any time. And you know, I've had patients that can't breathe in and out of their nose, that it's like uncomfortable. So I just guide them to do whatever works for you. And that applies to anything within these implements. Take it and make it your own. So we have time for one more here. Are there any burning questions? Because I'm going to have to, once I wrap up, I'm going to have to jet out of here. No? Okay. Well, Lieutenant Muller can certainly bridge the gap here. And my contact information is there if you have any questions. If you need any support for your individualized department, I'm always willing to offer that. And if I can't, our staff is willing to be there for you. Okay? So one more. So this one is a little bit different. And this one integrates a level of visualization. Okay? Has anybody here ever done a visualization before? Yeah? Okay, great. So again, I'll have you go ahead and get comfortable. Feet on the floor, hands in the lap. Go ahead and close the eyes or soft gaze towards the floor. So I just want you just to tune into the breath at the nostrils and just notice and perceive. And just circulate that breath throughout the body, noticing into your body, noticing any tension, any holding. And if your shoulders are tense, allow those to drop. Allow the feet to weigh heavily into the floor. Just allow yourself just to sink. And just really bring a lot of sensing into the body and just tracking sensation, perceiving sensation. And imagining also that as you're breathing in peacefulness, health, and healing, and you're breathing out any tension, any anxiety, any worry. And you can imagine that turning to smoke, going out with the out breath, and going off to the ends of the universe, far from you. So now we want to begin to circulate energy throughout the body, through that breath. And imagine that breath circulating and bringing with it that healing into any areas that may need it. And you can imagine that as you're doing that, that those areas are filled with light, with positive energy. And that any negative information is turning to smoke and going off to the ends of the universe. And now we want to create a greater sense of groundedness, and this is very useful if you find yourself discombobulated from an experience. And I want you to bring awareness to the base of your spine. And I want you to envision a tree trunk going all the way down into the center of the earth. And it's sprouting about 1 million roots. You can utilize the visual of a redwood and its network of roots. And really bringing you into the body. Now I want want you to imagine that through the soles of your feet, you're pulling in the core energy of the planet. And that's going up the legs and cascading down that redwood tree. And envision yourself now underneath a waterfall. And this is a cascading waterfall. Brilliant, pure water. And it is cascading over your head. And it's going all the way down to the base of the spine, through the body, meeting at the base of the spine, that core planetary energy, and going down that tree trunk. And just see and notice if you can perceive any sensation with that. And just imagine and intend that it is washing away any negativity, any disease elements, any tension, any holding. And in its place is this sense of peacefulness, this sense of comfort. And see and track and notice if you can perceive any sensation. And if you don't, that's okay. Just allow the body and the mind to relax as much as you can allow. And this is something that you can sit with briefly and something that you can revisit for longer periods of time. So now I want you to go ahead and take a really deep breath in through the nose and exhale through the mouth. Again, in through the nose, exhale through the mouth. One more time, inhaling deeply, deeper still, circulating that air, and then exhale through the mouth. Very slowly and gently wiggle the fingers and the toes, soft, subtle movements. And when you're ready, you can open your eyes, relaxed, focused, and engaged. Okay, so there's great power in our gray matter, as you know. And the mind really does not know the difference between what we imagine and what we experience. So we can utilize visualization to improve performance. We can utilize visualization towards healing. This is an integral component of Herbert Benson's protocol. We do not rely on visualization per se. Herbert Benson's protocol, if you read the Relaxation Revolution for healing, is to first start with the relaxation response through body and breath, and then to move into visualization and affirmation. In visualizing healing coming through the body, if you have an attachment figure, integrating that, it's a great time to use it. I just worked with a geriatric couple that was Christian, and that worked superbly for them. So any questions as we wrap it up here?
Dr. Bertone, that was great. It was an hour well spent. Thank you so much.
I appreciate it. It was my pleasure. And if you guys need any further trainings, we're more than willing to support you. In fact, we have yoga coming here in a couple months, so you guys are going to get a chance to be human pretzels. Thank you so much. Take care, guys. Thank you for having me.